When I think about genetics in breast cancer, I think about two types of genetics, if you will. What the focus of the talk was on today was hereditary breast cancer genetics. So basically thinking about what genes a person is born with, and are those being passed through the family that cause or may increase the risk of developing a breast cancer in the future. However, in those genetics, we think about how, if we find a gene mutation, how is that breast cancer going to be treated, and how can we prevent breast cancer in the future? However, the other sort of cancer genetics field you think about is tumor genetics, or when you have a breast cancer, especially in the metastatic setting, and you're looking for more treatment options in terms of what chemotherapy to choose, or is there a targeted or biologic agent, that's when you actually take a piece of the actual cancer and you send that off for genetic sequencing. And rarely your tumor comes back with a mutation for which we have a targeted agent. There's a certain mutation that's unique to the cancer, but for which we have a targeted drug. So I think that's one exciting field that hasn't, its potential hasn't been realized to date because it's very rare to find a mutation and the availability of drugs is still limited. But I think it'll be exciting to see where that goes in the next 10 years, especially now that the NCI has a research program called the NCI Match, that they're trying to match targetable agents with these mutations that are found on tumor sequencing.